Welcome, everyone. We're going to get started in 1 minute. We still have a lot of people logging in, so I'll give everyone just a minute to get logged in. Okay, well, I'm going to get started. So good afternoon, everyone, and welcome to Transit Tuesdays. I'm Jacqueline Montgomery with the California Association for Coordinated Transportation, better known as CALACT. And as you know, these webinars are being hosted by 10 state associations. Next slide, from Washington, Arizona, California, Colorado, Illinois, Tennessee, Virginia, Pennsylvania, Florida, and the Southwest Transit Association, which covers 8 states. These webinars will be hosted by different states throughout the different Tuesdays as we continue these webinars. Today's webinar is Human Resources Best Practices During a COVID-19 World. Next slide. I want to review a couple housekeeping items. Next slide. Before we introduce the speakers. This webinar is not for the press and cannot be duplicated or published in any manner without the permission of all the associations. All attendees are muted and will continue to be muted. If you have a question, please answer the questions in the question box. As we go through the program, you'll see we'll do a welcome and introductions, we'll do the presentations, and then after all the presentations are finished, we'll go to questions from the audience, and then we'll do a quick wrap up and adjourn. Next slide. If you want to ask a question, there's a question box on your dashboard to the right of you. You should be able to type in your question. I would prefer it if you guys have one of the panelists that you would like the question directed to, if you would put their name first. For example, Kelly, my question is da-da-da, or Laura, my question is this. So if you guys can do that, I'd really appreciate it. And please enter your questions as we go along, because we will try to get to all of them at the end of the webinar. All of the PowerPoints are in your handout session of the dashboard to the right, so you can click on those and download them during the webinar. After the webinar, there will be a recording, and all of the PowerPoints will be on all the association websites and will be up for your review. So with that, next slide. I'll be introducing our speakers. So first, I want to introduce Lori Korf. Lori is the Transit Director from United Community Action Program, Inc., who operates the Cimarron Public Transit System, a 5311 program serving 5,238 square miles in 5 rural counties in north central Oklahoma. Next, I'd like to introduce Kelly Halcon, is currently the Director of Human Resources and Risk Management for Monterey Salinas Transit District. She has worked with the HR department at MSP for close to 17 years. Kelly has a broad knowledge with the HR and risk industry that includes labor relations, labor contract negotiations, benefits administration. Hang on, I need to mute somebody. Okay, I think we got it done. Sorry about that, guys. Labor contract negotiations, benefits administration, compensation, workers' compensation, recruitment, risk management, liability and legal issues, training, and employee development. Third, we have Ms. Jennifer Hirsch, who directs the administrative team of Metrolink in Moline, Illinois, and leads the agency in community outreach, organizational development and management, workforce development, media relations, public relations strategies, and strategic planning. She has been recognized as a Quad Cities Leader Under 40 and a Top 40 Under 40 by Mass Transit Magazine. Ms. Hirsch holds a Bachelor's of Arts degree in Human Resources and a Master's of Business Administration degree, both from Harding University. Jamie Leonard is a human resource professional with almost 20 years of experience. She is currently the Director of Human Resources with Rabbit Transit. She is a servant leader responsible for leading the entire HR function for a regional transit provider. Jamie earned a BA in Spanish from Bloomsburg University and her MS in Human Resources Management from Thomas Edison State University. Next, we have Lawrence Bond. Lawrence Bond is a resident of Carbondale, Colorado, and has lived in the Roaring Fork Valley for over 10 years. An attorney by trade, he switched careers almost 4 years ago to become a human resources generalist with the Roaring Fork Transportation Authority, specializing in recruitment and onboarding. Prior to joining RFTA, he worked as an attorney with Balcom and Green in Glenwood Springs, Colorado, with a primary focus on litigation. Lawrence is originally a native of Macon, Georgia, and completed his undergraduate degree with a bachelor's in history from Lafayette College in Easton, Pennsylvania, and after living in Aspen, left to attend Villanova University School of Law. Cesar Portillo, before coming to Community Transit, Cesar served as the Associate Vice President of Human Resources and Chief Diversity Officer at California State University, San Bernardino. He created a high-functioning team that became a resource for the university community and sister institutions in the California university system. He implemented programs that were used as models for other institutions within the system. Prior to that position, he served in various human resources leadership roles at the collegiate level at Bellevue College, University of Washington, and San Diego State University. Cesar has an executive leadership master's in business administration from Seattle University and a bachelor's degree in political science from the University of Texas, El Paso. And with that, I'm going to turn the presentation over to our first speaker, but I want to thank all of our speakers that we have from an amazing panel from the East Coast to the West Coast. And I really appreciate all their time and effort that they've spent putting this webinar together. So with that, I'm going to turn it over to Kelly Halcon from Monterey Salinas Transit. Kelly?
Good afternoon, everyone. My name is Kelly Halcon, and I'm the Director of Human Resources and Risk Management for Monterey Salinas Transit District. And I'm going to be talking about the human resources response to COVID-19. Next slide, please. So some of the things I'm going to discuss is the HR role in the organization during the COVID response. The next thing is HR's responsibilities in the organization during these uncertain times. And then the last thing is keeping in mind the morale and well-being for the support of our staff and our employees. Next slide, please. So just some quick facts about Monterey Salinas Transit. We serve all of Monterey County, including San Jose and Templeton, so it's about a span of 130 miles. We have two operating bases that are about 17 miles apart. One's in Monterey and one's in the Salinas Valley. We have approximately about 215 employees, with 136 of them being bus drivers, coach operators. We transport 4.1 million passengers, and we travel over 3.9 million miles annually. As of June 8th, we in our county had 732 positive cases with 424 recovered cases. As of this morning, that number actually went up to 1,015 with 598 recovered with 10 deaths. So at this point, MST has been lucky enough where we have not had any of our employees test positive at this time. And I'm going to go into what I think is a key driver of that. Next slide, please. So looking at the human resources role within MST during this response, we went into response mode quite quickly. About March 16th is when the county decided to start closing all the schools, and California started to go into its own shelter in place. We activated our internal EOC command center. So during that time, HR was involved with the meetings of the EOC, and that was about over a period of about a week. And so within that command org chart, there is the safety position, liaison position. And due to HR being inundated with concerns from employees and employees having a million questions and just trying to figure out what's going on, we had to take a step back because we were in response mode ourselves. And so we weren't able to join the EOC group that met. They were meeting every day at 8:30 in the morning to partake in discussing issues. So one of the things that happened was we had to develop quickly a checks and balance system in order for the group, the EOC group, who was made up of management staff, to understand what was going on with the employees. Next slide, please. So as I mentioned, HR was involved in the first weekend to help respond to safety and employee guidance on what to do in the COVID response. And so given that, I took a step back and redeveloped what our HR department was going to do. And we made the decision that my risk and security manager would take on the role of the safety officer within the EOC so that HR could work on processes and addressing employee concerns. However, within about a week and a half, the EOC was making decisions that really affected the unionized employees, and it created a bit of a conflict between the MST EOC staff and the employees themselves because there wasn't enough time to address concerns. They were just, when you're in response mode, you're making a quick decision and you're moving forward with that. So given there was a conflict happening and with ATU, I got brought in to become a liaison as part of the response. And so we developed an HR unit, and my job was to liaise between the employees and the EOC response to make sure that we had coverage in all those areas. Next slide, please. So HR's responsibility during the uncertain times is immediately you're developing processes on the fly. And unfortunately, given that this is a new response and something that was uncharted, you're trying to provide guidance in changing environment. CDC was changing their guidance and their recommendations on an hourly, daily basis. And so you're trying to, you might have organizations or boards that are looking for policies, and I had to quickly say, we can't develop policies as this is changing. We just need to develop a process, and that way we can adapt that process to what's going on. And then we had to look at providing helpful information to the employees. What were their concerns? What were they looking for? What did they need guidance on? I mean, not only do they want guidance on how to do their job within the restrictions of sheltering in place, but they also want to make sure that they were helping their families and that they had resources to go to that were available within the county. Then we had to look at, you can't just stop training your employees because now you're in a COVID world. So we had to look at, with social distancing, how would we be able to train our employees on things that were going on or require training? So we started switching to online platforms in order to do that, where we couldn't do a person-to-person training. And then, as I mentioned before, we were trying to set up a liaison between the employees and the EOC group. So in order to do that, I came up with the idea of having daily briefings with our union leadership to discuss issues and take suggestions. And I really think that this drove the morale within the organization. Because we had a tie-in to the employees, our union president was able to let us know what was happening, and it really helped us develop some of our processes and plans on moving forward that are even going into our recovery plan. Next slide, please. So while you're making these decisions, you also need to keep in mind that there's a human factor involved in this, that there are employees, and employees have feelings, and they come to work because they're there to get a paycheck and to support their families, and they still have concerns. They have concerns about protecting their families, protecting their own health. And so we had to figure out a way of providing guidance on how to keep themselves and their families safe. So we were looking at, videos on how to make your own facial covering. We looked at videos on and provided that to the employees and their families. We found videos on how to use those masks properly. And then we had some great partnerships that are within our county of health resources that we had developed for over 10 years. And they immediately, we reached out to them and they responded. And they had an online source for us, Montage Health Group, that works with our 2 community hospitals. And they were able to provide an online resource for our employees to ask medical questions and even to do like a pre-check to see if they had symptoms that were COVID related and get that referral to go and get tested if need be. Also, early on in the response, our executive team, given that we were, HR was inundated with questions, felt that we really need to go out. So this is all the directors and our CEO. we put a schedule together and we committed to staffing in the morning and the afternoon for about 2.5 weeks, the employee break rooms, and just sitting down and having like mini town hall meetings with the employees. So we talked to them about their concerns, we answered their questions, and then we just kind of talked about what we thought was going on, or explain stuff that was happening on the news, and just really having that human touch of addressing concerns. We implemented a folder within our network that housed SOPs, employee memos, and new COVID posters so that our employees could have a resource to look to or print stuff out. This is because you, any given day, all of you know, you might have been putting out like 20 emails to address COVID related type of topics. And let's just be honest, an employee is not going to read 20 emails, let alone read memos they're peppering a wall. So we had to give a resource to our employees that they would be able to reach when they had time. And then we had employees that, the admin employees, we were required to do social distancing. And so you're looking at telecommuting. And so we worked with our IT department and we bought laptops for employees so they could either share or take them home and be able to telecommute. So we implemented schedules and worked really being flexible in giving people the opportunity to be at home for various reasons and work from home, or to have that opportunity that they were able to come in a couple days and then work from home other days. Next slide, please. So as I mentioned, we created a folder for employees who would enhance their access to all COVID-19 related memos, posters, guidance, and SOPs. Executive staff met with the employees in break rooms. We established staff resource tables in the break rooms. So these were staffed by our mobility department, our mobility specialists. They work with the public and do ADA certification and our paratransit certifications. And during this time, we were doing in-person assessments or interviews. So we decided to repurpose them, and they came in and they helped give our employees and talk with them, but also to give them handouts of the stuff that we had posted up at the wall, or to give some guidance on what they could do, or resources that were out in the community that we thought could be really helpful. We hosted a supervisor Zoom Q&A on how to respond to COVID-19 related questions, because frankly, supervisors, managers, they're your first line of, I shouldn't say defense, but offense when working with employees. And so we wanted to help them understand and navigate these new uncharted waters. As I mentioned, daily briefings with the AT leadership. We started implementing employee Zoom town hall meetings, and now that's led to, we have a monthly town hall meeting Thursday following our board meeting, so that the employees can ask any questions they have. We take suggestions, and I think this is really important because as you move from response mode to recovery mode, we're building a new plan. You all are building a recovery plan, and we want the feedback of our employees on how to move forward in this new world. We relied heavily on employee suggestions, our ongoing response efforts, and as I mentioned, in the recovery plan development. And that's been really helpful, getting where we see the need for transportation. Given what was...
This is Jackie, real quick. Sorry to interrupt you. I feel really bad, but there's some kind of background noise coming through on your audio, so I don't know if you're moving or moving papers, but it's really picking it up. So.
Oh, sorry. It might be.
That's okay.
Okay. And then the HR department, we had to figure out how to work and address employee concerns and help them with their needs, but doing so with social distancing protocols in place. And so we worked out a schedule where some of us were working from home and some of us were working in place. And then we had to work out ways of meeting with employees, but still making sure that we had the social distancing, facial masks, those type of things. And then we partnered with our public information officer, our PIO, in the development of internal and external messaging and social media communications. And this is really important because we wanted to make sure that whatever we were telling the public is what we were telling our employees. And so whatever directive we were telling the public about writing, we wanted to make sure that the our own employees understood what we were asking the public to do, and that what their responsibility was in helping us make sure that this was all covered. Next slide, please. So here's just some of the messaging that our marketing department put out regarding COVID-19. So as you can see, we were calling our employees wheel heroes and getting their pictures out. We took a picture of us having our town hall meeting and posted it up. So you could see there's our CEO in the upper left-hand corner, and we've got some drivers on there and other staff members. And then we took kind of a fun, we did on May 4th, Star Wars about keeping 6 feet away and social distancing. During this time, we had in September, we had a class of coach operators start. And so DMV closed down and we weren't able to test them, but we were able to put them out in the community and help with Meals on Wheels and delivering meals to the senior population that was sheltering in place. And as of today, we've been able to serve over 10,000 meals to our community. And I think that's part of MST is not only were we giving a service back to the community, but we really are trying to be there for our community during their time of need. So that we wanted to make sure that that was out and about. Next slide, please. So there's my contact information, and I'm sure Jackie's going to share all of this later on. And thank you so much for listening to my presentation.
Thank you, Kelly. Next, we will have Jennifer Hirsch from Metrolink in Illinois. So, Jennifer?
Yes, good afternoon. Thank you so much for inviting me to be a part of this conversation today. I'm really excited to hear some of the other panelists and what their best practices are as well. I'm Jennifer Hirsch. I'm the Manager of Administration for Metrolink. Next slide, please. So Metrolink is actually the Rock Island County Metropolitan Mass Transit District. We are in the Quad Cities of Illinois and Iowa. My agency specifically serves the Illinois side of the Quad Cities, and we have about 8 communities. We have our fixed route service, which is known as Metro. We have approximately 60 vehicles, 12 routes, providing 3.4 million trips a year. We have a smaller ADA paratransit service as well. And uniquely, we also operate a passenger ferry boat service on the Mississippi River. It is a seasonal operation that allows commuters to transverse across the Mississippi and get either to Illinois or Iowa and vice versa. Staffing-wise, we have approximately 150 employees, largely consisting of drivers, mechanics, support staff, and then a small administrative team of about 12 folks who provide the back office support in HR, finance, procurement, etc. Next slide, please. Today I'm going to talk a lot about communication. I feel that we were very strong in our communication avenues in response to COVID-19. Just setting the stage, as I mentioned, we are a small agency. We have one HR person, our director of HR, with oversight provided by myself. When COVID hit, we immediately designated her as our POC to handle all employee inquiries. One of the first things we did is we issued guidance to all of our supervisors to make sure that they were knowledgeable in what was happening. And a really convenient tool that she was able to put together very quickly was a COVID-19 leave database that helped us all in understanding where each employee was, whether they were taking, the variety of sick leaves available to them, when they were going off, and when they were returning. This was sent out on a daily basis to all supervisors and the management team, so we knew exactly what was happening within our organization in terms of leave. Next slide, please. I'm going to go through a number of the communication strategies and policies that we put in place that I felt were very effective here over the past couple months. We really started talking about COVID internally late February. Things were, really starting to develop. We, of course, weren't sure where it all was going to lead, but internally knew that something needed to be done. In Illinois, mid-March is when the governor began shutting things down. The stay-at-home issues were ordered, and we really had to jump into action. We started a weekly communication, formal communication from our general manager that week, and those have become commonplace in terms of just a formal way to let our employees know from our GM what's going on in terms of service or what's happening within the community. Just a variety of different topics have been covered in those weekly communications that have been extremely helpful and has helped put our employees at ease. A unique thing that I think we did was we held an emergency board meeting on March 19th that allowed our general manager to take emergency action moving forward. And this policy that our board passed has really helped us move forward in terms of the general manager and our chairman working together to make decisions regarding purchasing, service, personnel, etc. And again, it's been very helpful, so we don't have to necessarily wait for a board meeting to continue moving the needle. As I said, we started talking in late February about COVID and was able to kind of get a jump start on all of our PPE. So we had those in March and were able to distribute those to our employees, which gave them a little bit of satisfaction and was very helpful in helping kind of ease their fears early on that we were taking the safety and health of our employees very seriously. As many other agencies did, we went fear-free, closed our lobbies, implemented rear door boarding, all to help protect our employees. And we also increased our disinfecting of buildings and buses in March as well. I think one of the other things that was very helpful is our manager of operations was speaking daily with our supervisors, whether in person or at the end of the day, sending an email that was bullet pointing out every single thing that was happening that day. That email would include all of the previous days and weeks activities as well, and it was very helpful for our supervisors to have the tools they need to discuss what was happening with our employees. Our supervisors were, and still continue to be, having just daily conversations with our employees, getting their feedback, helping them understand what's happened. One of the things that we also implemented was weekly meetings with ATU. And again, that has just really opened the door to communication and allowed us to have some free-flowing conversations to help understand where they were coming from and how we could work together in response to COVID. We've had some joint messaging come out from our GM and ATU president in response to, for example, wearing a face covering. Some of our employees weren't quite on board with wearing face coverings, and having that joint messaging from the GM and ATU president really stressing the importance of that and why we need to be doing that has helped increase that. Kelly talked about social media. We too have had a pretty aggressive social media campaign, and I think that has been helpful to just reassure our workforce that we are out there communicating what the expectation is to our writers, and also, giving them some comfort in knowing that their safety and health is of utmost importance to us. We've had some really great press coverage too, which I think is very important in terms of communicating that message. We haven't had a whole lot of remote working. We are, again, a small agency, and really it's been all hands on deck, and I think that's really helped with our ability to communicate and respond. At the end of the day, we've only had about 10 to 15% of our workforce off at any given time. We haven't had to cancel any fixed route service as a result of that. And as of today, we also have had 0 COVID-19 positive cases. Next slide, please. Moving forward, we have developed a number of what we call restore committees, and these committees have already been meeting and have been meeting over the past couple of weeks. They include a combination of admin staff, drivers, and techs, and our committees are broken down into a variety of topics, but we felt it was really important to get our frontline employees involved in these committees to help us better understand where they are coming from and talk through the many ideas that we have in terms of reopening and fully going back to service. When we look at vehicles, facilities, community outreach, their input is greatly needed, and we want to make sure that we are not doing anything that they would not support. So we're really excited about these committees. As I said before, we've already started, and we've already gotten some really valuable feedback from our frontline staff. Next slide, please. So I think just for us, in terms of communication, I think, when you look at the positives that have come out of COVID-19, we have really, I think, in terms of, labor relations, that has really improved. We've been able to respond together as an organization. We've had a lot of teamwork occur. The Restore committees, again, are a great way for our employees to provide feedback on how we can do better. So we'll continue to really stay with all the communication strategies that we've put in place, and look forward to working with our employees as we move past COVID. And that's all I have for today. Thank you.
Thank you, Jennifer. Next, we're going to have Lori Korf, and there will be not PowerPoint, so from Cimarron Transit. Take it away, Lori.
Thank you. We're a mid-sized rural transit program in north central Oklahoma. We have about 54 vehicles and 65 drivers that work. And I'm going to focus on administrative leave to start with. In mid-March, when the governor announced the stay-at-home order, almost 20% of our workforce, they pulled themselves off the schedule. And with FTA and our DOT, their prompt response, we were able to keep everyone employed. So we had no layoffs. And when the Family First Coronavirus Response Act came out, we posted the signs at each site, reached out to update staff about eligibility. We mailed certification forms as needed and requested. And half of those who had pulled themselves off the schedule ended up being eligible. And the CFO and I had discussions and agreed upon how to code our timesheets and assist payroll and tracking for the tax credit reimbursement purposes. And most of the staff on FFCRA are expected to return within the next few weeks. And we tried to maintain contact, either telephone or email, throughout the time. And recently we mailed letters to confirm the date their leave expires. And it's important to remember that if you have any staff who've been removed from the random roster for more than 90 days, they'll need to submit to a return to duty UA before being placed back into a safety sensitive position. And those staff who did not qualify for the Leave Act and refused to work were allowed to use their sick leave and vacation accrual. And I'd like to note that during the first few months of the pandemic, we had many idle drivers. If our drivers were willing and able to work, we paid them their regular hours. And for auditing purposes, we created a base number of hours for each staff member. We used the average hours that they worked during January and February, and then paid them forward accordingly. And additionally, to assisting with keeping their immune systems up, allowing for self-care, reducing stress, we rotated everybody off the schedule at least one day a week without making them use any of the vacation or sick leave. And this was practiced for our office staff as well. And then recently our board approved a temporary increase that was effective for May and June. So for those staff and drivers who are willing and able to work, from the point that the pandemic came to town, we weren't able to go back retroactive to March, so we decided to pay $20 per day that they actually worked during May and June, and that was well received. And we just make a note of the total days worked on the timesheet for payroll purposes. And as our demand has been increasing and the need for drivers becoming more pressing, those who did not qualify for leave and who have not remained in contact nor returned any of our calls when we reached out, their personnel files have been documented and notices of voluntary termination were mailed. At this time, we're moving forward with the hiring process to increase our capacity. On returning to work, we had a couple of those staff members that did not qualify for leave. They returned the 1st of June, and it proved helpful to assign a mentor to provide refresher mobility securement training, as well as our PPE protocols, cleaning and sanitizing protocols, and any changes to the operation. We provided them a packet of memos, information, newsletters that had been disseminated during their time off, and the mentor shadowed them for part of their shift. And this was very well received and proved a positive way to transition them back to work. We have had no COVID positive employees. We had a couple of family members who tested positive, or we had drivers that transported a rider who later reported they were tested. We just quarantined them. They've since returned without contracting the virus. And of course, they were paid their regular wages during the quarantine time. We did recently have someone fly to another state that is kind of considered a hot spot. And so we have decided to pretty much quarantine them and then have them test before returning. We have one staff member who continues to express fear that she's afraid of returning. And so we will continue to attempt to pinpoint the fear to determine if it's legitimate, see what accommodations we can make. And we've been trying to communicate all of the PPE. We've got face shields, everything, all the extra steps that we're trying to do. And if this staff member refuses to return, we will use the average person test for reasonableness and possibly end up terminating their employment. In conclusion, we monitored the situation, created a pandemic response plan, remained proactive, and kept the staff engaged. We allowed downtime, and most importantly, kept everyone employed. And to this point, I haven't heard any words of dissatisfaction. So we're hanging in there. Hope you guys are too.
Thank you, Laura. Don't forget that you guys can enter questions in the question box, and we will get to them at the end of the presentation. So next, I'd like to introduce Jamie Leonard from Rabbit Transit in Pennsylvania. Go ahead, Jamie.
Good afternoon, everyone. It's certainly a pleasure to be able to speak with all of you this afternoon. So Rabbit Transit is the name that we do business as, and our formal business name is actually the Central Pennsylvania Transportation Authority. And we are currently in operation in 10 different counties throughout the state of PA. And those counties include Adams, Cumberland, Franklin, Perry, Union, Snyder, Montour, Northumberland, Columbia, and York counties. Within York and Adams County, we do provide 3 lines of service in each of those, fixed route, paratransit, and then also express service. And then the remaining 8 of the counties that we do serve, the line of service that we operate in those is paratransit. Across our organization, we currently have 444 team members. So that is just a little bit in reference to our organization. So I'm going to really talk about some of the messaging that we as an organization did as we worked through the challenging time of dealing with the pandemic. Number one, I think the thing to keep in mind is who knew this was coming and really how we were going to react. You know, we all really kind of had to pivot in a very fast fashion and make changes to our operations. So the one thing that I would say was key within our organization is we were all in this together and we really worked together. Our leadership was physically present and accessible at all times, and we never left the workspace. We were all in the buildings and certainly here. And with that, it was really an emphasis on communication, making sure that that was constant and ongoing. So some of the measures that we took, we focused on facts versus fear with our messaging campaigns. We developed countless memos that really addressed anything that was a regular update from our executive director that spoke about what we had changed and why. Also taking time to truly address the mental and physical health of our employees, as well as attendance concerns. We sent messaging out to the family and friends of our employees so that they knew that they were supported. We've had a huge focus on our EAP and the resources that was available from that. And we developed, with the messaging, a lot of visuals. Instead of having just text out there, it was visuals so that employees could really gather the information. So some of that was, if you were feeling ill, what you should do. Putting an emphasis on virtual care, how to properly wash your hands, glove usage, sanitizing your workstation or your bus, social distancing, mental health, and then ultimately wearing masks. And then again, I would say that we really did a high emphasis on mental health, making sure that everybody was aware of self-care and things that they could do to help them, whether that was coping strategies, just varying forms of mental health resources that were available, and really partnering with our EAP for a lot of that information. May was Mental Health Awareness Month, so again, just really having that as a front piece, and sharing out lots of tips with our supervisors and managers when it came to just self-care, and just really staying calm. So some of the resources of sharing out to individuals as far as self-care was, to talk about what they were hearing and how it impacted them. To drink plenty of water and stay hydrated. Certainly that can sound silly, but we often forget to hydrate when we're stressed or feeling anxious. Making sure that individuals were eating well-balanced meals and getting plenty of rest. Practicing deep breathing exercises to calm themselves and try to relax. Consider taking breaks from the news or accessing social media sites because there was obviously a constant barrage of information. Focusing on what you could control, like proper hand hygiene, preparing emergency supplies. And ultimately, I think it was very natural for everybody to think of the what ifs, could have, should have, but they don't really support and help anybody. So really to focus on what was positive, what we were doing good. To managing reoccurring stressful thoughts, incorporate that self-care and bringing joy into the day, whether that was reading a book, playing with your kids. The letter that was sent to employees really kind of stressed, the importance of what we were able to gain out of this unfortunate pandemic, and that was time, time with your families, and to take advantage of that. And to again, if you engage in physical activity, exercise, or relaxation, something again that took care of yourself. Through this process, we all know that fear is real, and how somebody processes that is different from individual to individual. So I would say it was also being accessible and listening to the employees, listen to what they have to say, and being present with them. And then again, just trying to reassure as best as you could and providing the facts. So our messaging continues. It's certainly, besides communicating with our staff members, it's certainly the communication to the public and vice versa, and making sure that everybody understands what we're doing and why we're doing that. Another thing that I would say is important that we did was employee appreciation, making sure that the employees that were working felt appreciated for the services that they were providing to our communities. And we did that through a variety of ways. It was starting with just simple thank yous, at the end of the day. We did goodie bags, we did signage, we did appreciation bonus where they did receive for their hours worked additional money. And again, that was to thank them for what they did. As we look into the future, one of the things that we are going to be doing is t-shirt days through the summer, on specified days where each employee will be receiving a t-shirt. And this t-shirt has a logo of Rapid Transit, but at the same point also has making a difference together. And that is something that on those designated days, everybody within our organization will be wearing them to really show what we do, because each and every day we absolutely make a difference in individuals' lives. As an organization, as many of my colleagues have talked about, we had to make some difficult decisions as well. At the end of the day, we did see our service reduced. So from that, we did have to implement furloughs or layoffs. And we did that through a voluntary measure, that if individuals wanted to volunteer, that they had the opportunity. And we were able to honor all of the requests that came in. And then certainly as they were off, we really just remained in contact with them and provided them information about what we were doing, what things were changing. And we have now begun to welcome them back. And I'll talk about that here in a short while. Also, if individuals were off for items that were related to COVID, whether that was somebody that they themselves actually were tested, a family member was tested, or they were quarantined, one of the things that I put into place was to just reach out to them on a daily basis. And I really received a lot of positive remarks back from that they felt that they were cared for and that we truly cared. And that was the intent, to really be accessible and available to them. And then certainly early on, we did develop a plan, for if and when we did receive a positive result. Up to this point, we have only had one employee who tested positive. And that individual had certainly been out of the workplace. So navigating through that was a little bit simpler. But again, just making sure that we were communicating out to employees as well as the public that we did have somebody test positive, and working closely with our local health officials and just really re-emphasizing all of the communication keys that we had put into place. We were also impacted with the Family First Coronavirus Response Act and the expanded FMLA. So just working through those challenges and the staffing issues that brought, but again, remaining in constant contact with those folks. Some of the neat things that I would say that we did as an organization is our one local hospital. We actually worked with them to provide high-risk transport to individuals that were going to be tested, or even individuals that once they were tested, to transport them to an area where they would self-quarantine. So the employees that were working with that, they were certainly appropriately trained, and they were provided all protective gear in order to do that. But that really just showed our partnership within the communities that we serve. And then we've also even delivered food to those who weren't able to get out, whether it was COVID related, just really make sure that they had access to that. And then, as I had shared previously, we have begun to bring people that were out of the workforce back into the workplace. And one of the things that I'm very proud of the team that I work with is that we've really created a return to work program or reorientation to welcome them back. And, with that recall, first step was really reaching out and recalling them, and then providing them all of the information of everything that we have put into place and providing them that information. And then once they were back in our classroom, it was providing them, number one, support. It was a transition for them to come back into the workplace. So to make them know that we were available and there to support them and welcoming them back. We did an EAP overview, and I was there for a Q&A if they had any questions or concerns. Then reviewing what had ultimately changed, and then just taking some time to go over passenger sensitivity, ADA, conflict de-escalation, defensive driving, as well as mobility securements. So those are certainly the items that we as an organization put into place. I'd like to thank you all for your time and allowing me the opportunity to share our best practices.
Thank you so much, Jamie. Really appreciate that. So next, we're going to have Lawrence Bond from Roaring Fork Transit Authority in Colorado. And Lawrence, you're up.
Hi, well, thank you so much for having me. We are, I think, like a lot of the transit representatives here, we also do span several different counties and multiple municipalities. One thing that makes RAFTA, it's RFTA, Roaring Fork Transportation Authority, unique is that we are seasonal in nature. So we do have some seasonal employees, especially during the winter time when we do a lot of additional service for the ski industry. We're our heart and soul, I guess, is Aspen, Colorado, but we also service many of the communities where workers come up from other communities into Aspen to work. So that's the commute. So we did, at the time of COVID-19, we had a lot of seasonal employees. So RAFTA, a little bit of background is we are the second largest transit authority in Colorado. Last year, we serviced about 5.3 million passengers. We have 365 employees, and that can rise a little bit, like I said, during our seasonal, especially in the winter time. So this winter, we had, I think, 200 total full-time drivers. Probably about 50 of those were what we would call seasonal employees. So just a little bit of background for you there. So RAFTA's COVID-19 emergency response plan was focused on 3 primary goals: protection of the workforce, protection of passengers, and continuity of service. When the outbreak first occurred, we had certain orders from different counties, the state, things like that. So sometime in mid-March, we started phasing down our operations until we really had a skeleton crew. The mountains closed, the ski mountains closed, and a lot of different municipalities were limiting bus operations, and there was some consideration of stopping the service altogether. But I think fortunately we kept working to provide that essential service. So we had a lot of different HR strategies, which I'm going to go through each one of these in brief detail. But I'll hold off for a minute. These are some of the bullet points of what we did as an organization, not necessarily human resources. So starting in very early March, we found a guide for public transportation pandemic planning and response. And we use that as a template for our COVID-19 emergency response plan. On March 12th, it was the first time we went before the board to ask for additional budget to take some of these actions. So one of the first things we did is we started fogging the vehicles every day, all night, basically. I hired, I think 6 new additional employees to help with this operation. So it was at night, we would fog every single bus to try to decontaminate it and sanitize the buses. We closed down the lobby of our primary station, and we closed all public restrooms. We very early on stopped charging fares, and we only used our buses that had the low floor backdoor buses so that we could load and deload from the back door. First step was we created a social barrier for our drivers so that they would feel safe. And then gradually later on, and still to this day, we implemented social distancing on the buses. And then we have a backup bus, which will follow those primary buses that are in service in case we do get to our passenger limit, which unfortunately is fairly low on these backdoor loading buses, which are, I guess this is a good picture of it there. Certain counties did this first, but once one did, a certain city required masks for everyone, we started implementing that as a requirement for all of our buses. And now we have daily check-in procedures for any employee coming in. They have to sign that they don't have any symptoms of COVID-19, and I'll show you that form at the end. And currently we are still working on this, but it's our goal to get barriers up for all of our drivers so that we can eventually start doing front door loading again and charging for fares. There's a picture of one of our mechanics. He's behind a plastic sneeze guard. It might not be that easy to see. So early on, our goal was to protect our employees, obviously. We did have a few employees. Aspen's a bit of an international city, so we had people flying in from all over in early March and, well, prior to that as well. So there was a concert, and there was a particular outbreak. So COVID-19 did spread pretty quickly in these mountain communities out here. I think Vail and Eagle County made most of the news, but we had our share as well. So we don't know, due to the lack of testing, how many employees we have COVID-19, but at least one employee was had to be airlifted from the local hospital to a larger facility. He was a sad story, but also a success story from an HR perspective, and I'll talk about him a little bit more later, because we were able to check on him and through some of our reporting procedures, and we were able to basically kind of check in on him and found out that he wasn't doing okay, and that's when we called 911. So one of the first things we wanted to do was make sure nobody showed up to work sick. There certainly was a culture here at RAFTA, and probably in most transit authorities, where, you know, calling in sick is something frowned upon and penalized. So it was difficult to change that culture, but we really wanted to make sure that anyone who had any symptoms would not come into work. So each department had to put forth an attendance policy, a COVID-19 kind of operational plan. And most of that was working from home, but how do we social distance? So that was one of our first steps. After that, you know, any employee reporting any symptom of COVID-19 was required to stay home from work. And then from there, HR would call that person at least once a week, but it all depended on the situation. We'd have a return to work plan for them. If they had a symptom such as a fever, then they had to be out according to CDC guidelines. And obviously, you guys know that things were changing daily early on, but we locked in a 14-day period. And we discontinued penalties or requiring doctor's notes at first for any employee that called in sick. We just wanted to make it really easy and simple and penalty-free for not coming to work. And penalty-free, of course, includes making people whole with their wages. So other people have talked about this as well, but we did change our sick time policy as well. Back to seasonal employees, we never want to lose a good employee, regardless of whether they're designated seasonal or full-time. So we did actively promote everyone effective March 1st, so that everyone could be on our insurance benefits, and we expedited that process. It was a lot of work. We had to basically communicate with about 50 employees to try to get them all onto our insurance and payroll in a full-time capacity. Any employee that declined a promotion, we allowed them up to 40 hours of sick leave, so even though they didn't have any sick leave with us. Certain frontline employees remained as seasonal. Currently, we're not actually allowing anyone to work with us without health insurance, so we provide them with no-cost health insurance for an individual, because we don't want to have any sick employees or employees with COVID-19 kind of ruin their financial credit and lives moving forward. So we took that action as well. We provided paid time off for high-risk employees. So we identified who was high risk. We asked people to come to us if they had underlying health condition, and they were allowed to use paid time off. If they didn't have any paid time off, we allowed them to go into negative sick time accruals. for any employee. We went through the Families First Coronavirus Act response. We called every high-risk employee, told them that they were getting an additional 80 hours, or if they had childcare needs, the 2/3 of pay. And then we also did, we didn't technically furlough anybody, but we did, due to our large reduction in service, we did have a number of employees and we didn't have work for everybody. So we did help people file for unemployment claims. Some people are still out, but we are kind of ramping back up and hoping to go full in about 2.5 weeks back to, well, our next phase ramp up, which wouldn't be what normally would be, but. So for paid sick leave, we had year-round drivers. We allowed them to go into negative sick accruals up to 160 hours. For seasonal employees, 40 hours of paid sick leave. High-risk employees are allowed to use their sick time to stay home and shelter in place. Administrative leave, someone spoke to this earlier, but we did a similar thing where if you were available, ready, willing, and able to work, you would be paid 38 hours, no matter how many hours you worked. So if you worked 12 hours that week, you'd get 38 hours. Obviously, if you worked more than 38 hours, you'd be paid for your time. And drivers were paid either the shift that was eliminated or the shift that they drove, whichever was higher. So we were just trying to continue with a stable workforce because it is very difficult to recruit and retain employees in our mountain community. So this is the bulk of the HR work was in communicating with employees, tracking, and employee communication. So at the height of our coronavirus outbreak here, we had about 84 employees out for various reasons. Not all of that's coronavirus. Some of it was childcare. Some of it was had nothing to do with coronavirus, but we still attempted to contact them as much as possible to make them feel like they were part of the team and part of the Raftic family. So we called them the high-risk folks who were out due to underlying health conditions to determine their COVID-19 symptoms and to assess their options for returning to work. Regular communication check-in on sick or high-risk employees. And this is where I spoke earlier about the employee who was taken to the hospital. He's still our only confirmed case, but we feel very strongly we had probably about a dozen or maybe slightly less than that. But there's a few people who had very strong symptoms of COVID-19 early on. But this gentleman, he reported being sick on a Thursday, and by Sunday he was being airlifted to a hospital. So it happened really fast, and it's the director of human resources here at RAFTA happened to call him just to check in on a Saturday, and she could tell that he was incapacitated and wasn't responding properly. So she called 911. Within a few hours, he was being airlifted to the larger hospital here in Colorado, and she likely saved his life. So that was HR's primary duties, was just reaching out to these people who were either high risk or sick. And we still, anybody who does call in sick now, we still make sure we call them immediately to kind of assess the situation, protect their privacy, of course, but we want to be the ones reaching out to them to make sure that they are okay, to see when they should be able to come back to work. So we have a whole protocol for that. And we, there's more examples of why we needed to call employees here. It was a fairly long list of calling people. It was good, 7-8 phone calls a day for each of us in the HR department. We had to, I think one thing we're particularly proud of here is we do have a union that is our driver pool, and we've really worked closely with them, and I think we've built a lot of goodwill with our drivers by doing that. We've helped. They've been integral in deciding some of this policy. They've been on our weekly calls. You know, they're not management, but they get on these weekly COVID-19 calls that we have. They jump in about employee relations. They jump in about, they've been helping to design the sneeze guard barriers that we've been working on. And the list goes on. But listening to the employees has been, I think, tremendously beneficial for us. And labor relations have never really been better. This is a document that we use now for any employee that is coming into work. It's our COVID-19 screening form. We track daily screening for every frontline employee. So they would fill this out when they check in with dispatch or with their foreman, and HR then gets the form, and it's not as time consuming as I thought it would be, which is good. We are just tracking it by day, not by employee. And we're working with our IT department right now to digitize this. And we've also created a acknowledgement form for any employee that wants to work who's high risk or might have some other rationale. I don't have that here, but it's a high risk acknowledgement. Some might call it a waiver, but it's really just an acknowledgement form to make them, educate them on the risks that they're taking as a frontline employee. And that's all I have.
Thank you so much, Lawrence. So next, we're going to have Cesar Portillo from Community Transit in Washington, and we'll be bringing up your slides, and the questions are coming in, so please keep sending them, and we'll answer them after Cesar is finished. Take it away, Cesar. Thank you.
Thank you. Hello, everyone. I'm very happy to be here. I work at Community Transit, which is located in the Pacific Northwest in the county of Snohomish. We provide services to the county plus commuter services into Seattle, Washington in the county, King County. You're probably wondering why the name Return to Base. We talked about that. We have a large number, 2/3 of our employees are actually working on base. The 1/3 is continuing to work, but they happen to be off base. My presentation to you will be about what we've done to bring back all of those employees who have been working off base. So if you could go to the next slide, please. As you've heard from all of the presenters, communication is very, very important. And what you get out of communicating consistently, both with the employees and with the union, is that you have a more informed workforce, and you really improve the relationships with the employees and with the unions as well. We discovered that communicating made a huge difference, and our relationship with our unions have also improved. We were meeting with them at the outset of this crisis once a day, and now we're meeting 3 times a week, once a day every day of the week, and now it's three times a week. We reach out to our employees in a variety of ways. Emails have been the primary way of communicating with all of our employees, and also phone calls. Individuals who have not been on base, we have followed up with them via phone calls. Employees who have been on leave are contacted by our HR staff to inform them of the various benefit changes, as others have spoken. And again, they are very appreciative of being communicated with and being provided information, because as all of us have experienced, it has been changing almost daily. So it's difficult for us to keep up with everything. It's incredibly difficult for them as well. In our steps to determine how we start to bring employees back, we surveyed our employees to get their opinions about returning to base. As you all know, people have different perspectives and hear different experts talk about the virus, and so there are many opinions out there, and we wanted to get a better sense of what our employees thought. So we can go to the next slide, please. So the other piece that I wanted to talk about was our approach to returning employees back to base. As I mentioned, we have 1/3 of them are working remotely. We did a lot of research. There is nothing new about what we are contemplating. There are many countries throughout the world that have started to reopen. We have multinational corporations such as Microsoft that has offices throughout the world that have started the process of bringing employees back to the office. And so we looked at what other corporations were doing. We also looked at what other both private and public entities were doing. So a lot of work went into the research on bringing employees back to work. Our choice was to do a phased approach. And it's really what the literature has referenced, that really a phased approach is the best approach. Some of you mentioned that you don't have a lot of employees who are working remotely. We have about 187 participants on this call. I'm assuming that many of you do have a large number of employees working remotely, so hopefully this information is helpful to you. We are also modeling our approach based on what the state of Washington is doing. The state of Washington calls its reopening of the economy Safe Start. And we use it as a reference point because we want to be in lockstep with what the state is doing, what the counties are doing, because we will ultimately have to serve those employers and those employees who are opening up, and we need to be prepared to be able to deliver services to them. We, in the phased approach, we recognize that there are many employees who are working from home but really want to be on base. We have other employees who are neutral on the topic, and we have other employees who have real concerns for a variety of reasons, including one, they're in a vulnerable category. They're looking after a person who is in a vulnerable category. Or three, they simply are very uncertain about what the transmission is and what the impacts of the virus would be to them. So they have some real fears. We have a commitment to ensure that we address them and not dismiss those concerns. We need to, in our phased approach, we also recognize that there are various perspectives, and our plan is around these steps that I've already mentioned, but primary is safety and employee focus. It's the safety of our employees paramount, and so those are the factors that went into consideration. If we go on to the next slide, thank you. One of the things that we discovered in doing both the survey and in speaking with our employees is that there is this dichotomy between employees who are working on base and those who are working remotely. And I think those of us in human resources get to see this more frequently, where there's always this perception that one person is doing more work than the other. And to some extent, that has played out here. There is this perception about people working remotely and what are they really doing working remotely, while the people working on base, they know what they're doing. And so there's this rift that we recognize, and we're trying really hard to address it once everyone starts coming back to base. And then, it's reasonable, given our experience prior to COVID-19, our HR experience, it's reasonable to expect that these misperceptions and misunderstandings would have existed, and that it is important that we address it as we continue to develop the plan. If we can go on, no, we're fine. So what are we doing now? One of the things that we're doing in order to bring employees back to base, we are taking, as I mentioned, a phased approach. The second is that we're looking at the needs of our employees and the managers. There are employees who are ready to come in. There are those that are neutral and those that may have other concerns that we need to work with and continue to use other types of leaves that may be available to them. So that would be how we would identify employees to come back to the workplace. The other step that we're taking is that we've also surveyed our managers to determine whether they have a good sense of where their employees are with regards to returning to base. What are their concerns? What is it that they would like to see implemented? And just to get a better sense of where they are in coming back. We are also planning a Zoom meeting actually this week, and as a matter of fact, with these managers, so that we could engage them in a conversation about what will it look like for them and their work unit to return to base. And the reason that we chose a Zoom meeting where we would bring 4 or 5 different managers is that we want to continue, we want to start to rebuild community. We discovered that by having such a large number of employees off base, that we were losing the sense of community that we're very proud in community transit. People have been away since March, early March. It's a very long time to be away from the office, to be away from your coworkers that you haven't seen, you haven't really interacted with, other than a phone call or a Zoom meeting off and on. So we're coming up with ways of how do we start to rebuild that community, and by bringing managers together to talk about their concerns, to talk about what they think might work, and for us to provide them the expertise on what is possible, I think we'll start to rebuild that sense of community. So as has been mentioned before by other speakers, there are a variety of tools that we would be able to use, alternate work schedules, different shifts, continuing a percentage of employees to work remotely, or some remotely and others, and alternate remotely and working from base. So there are lots of tools that we have explored, that we have identified, that we will use to support the managers in helping their employees. And just as a point of reference, we have approximately 100 employees who have been working remotely. If we can go on to the next slide. Thank you. The other very important point is that we've had 2/3 of our employees have been here on base. So we learned a lot since March, since actually February, when we first learned that the virus had arrived here in the United States. So we've learned a lot. We've learned a lot working with the union. We've learned a lot from all of our employees. So we're using those lessons that we learned to create a safer environment for all of our employees. The plan that we're developing is designed around flexibility, and also with the ability to move, to open up more, to bring more employees back, or to retract. As all of us know from listening to the news, it's really uncertain whether or not there's going to be a spike. And so we need to be prepared to continue to move forward or to pull back, depending on what happens in the fall or early next year. As I mentioned, we looked at a variety of employers. We knew that we were not the first ones to consider this question, and the research was great. It really expedited our understanding of what was possible. It really expanded what steps we would take to reintegrate our employees, to work with the managers, and to communicate with our employees. And the last point that I want to leave you with is that we also recognize that every situation is going to be different. So each employee is going to, each situation will be unique. Each work unit for us will be unique. And we will have some employees who we're going to have to work with very closely. And we also need to have a high level of flexibility. Thank you for your time, and I'm happy to take any questions at the end.
Thank you so much, Cesar, for that great presentation. And I'd like to thank all of our panelists for their presentation today. I know if we could give a virtual round of applause, I certainly would. So with that, again, please enter your questions in the question box on the dashboard. And I'm going to read or have a question ask for our panelists. Several people asked if you guys could share the forms that you talked about today, like your leave form, or Larry Lawrence referenced a kind of a form for if you're showing symptoms and wanting to go to work, or you're maybe shouldn't be going to work. So if you guys wouldn't mind sharing those, that would be great. We'd really appreciate that. So if you can email them to me, and I'll send them out to everybody to place on the website. So our first question is to all the panelists. Did any of the employers here today require COVID testing for all their employees? Who would like to answer that?
This is Jamie Leonard. We did not.
This is Kelly Halpin with Monterey Salinas Transit. We did not meet that requirement.
And this is Laura with Cimarron Transit, and we did not.
This is Cesar with Community Transit. We did not, primarily, as all of us know, there was a real difficulty in getting any test available early on, and so that was primarily one of the reasons.
Yeah, and this is Lawrence, and it was a very similar reason. What we did do is we spoke to our insurance carrier and worked with them on waiving any copay or fee to get tested. So if our employees can get a test, then it would be free to them to do so.
Thank you. Okay, our next question is for Jennifer. Did you have drivers or other employees who refused to use PPE, such as masks, and how did you deal with them? And other panelists after Jennifer, if you have the same situation, you can answer also. So Jennifer?
We haven't had anyone refuse per se. We are encouraging, highly encouraging, and also doing the same with our riders. I just think organically it went from folks who were a little bit resistant to it at first, now understand the importance of it. And that just, again, happened very naturally over the course of time. So we haven't really, again, enforced it per se, but we are at a point where our drivers are using the face coverings now.
Thank you. Any other panelists that are have had this situation in their agency?
This is Kelly Halkin with Monterey Salinas Transit. We didn't have issues with our drivers wearing facial coverings, but as of this morning, I have a couple of drivers who are taking exception to wearing, we procured N95 masks, and we are putting together PPE kits for them to use when they are securing individuals with mobility aids, and to give that extra protection. And so many of the drivers have complained that the N95 masks are uncomfortable. And so we are basically telling the employees, look, this is for your safety. We really want to make sure that you stay safe. This is just a little bit of added protection so that you feel comfortable getting within that 6 feet distance of securing an individual.
Thank you. Anybody else?
This is Lawrence with RAFTA again. I would say we've had plenty of complaints about it. There's no question about that. It's from uncomfortable to I can't drive with this thing on my face. It's out there. I think the best thing that we've done is it's just a bright line rule. If you have passengers or are picking people up, then you have to wear it, and it's of course easy to lean on and say these are also county rules and municipal rules, and depending on where the driver is, so we need to be consistent. So I think that consistency has helped in my response to those complaining drivers, and also having worked with the union to get them on board, which they very much are, helps to say, it's a company-wide effort, and it's not just a HR directive. So that helps. But certainly you have to be conscious of the fact that they're not going to like to wear them all the time.
Anybody else?
Hi, this is Jamie from Rabbit Transit. So we have certainly had some employees that have posed some concerns, and certainly went down a reasonable accommodation aspect with them to see if there was something different that we could do, but would still provide them protection. So some of the things that were ultimately evaluated as part of that was like a face shield, just to, again, make sure that they still had a covering that was over their mouth and nose. And again, very similar to others, there are employees that do not enjoy wearing them, but I think they recognize why we're asking them and requiring them. If they are in a vehicle and there's no passengers on board, they can remove it. And if they are behind the barrier, they could also remove it as well. Because obviously, as we head into the summer months, we also recognize and don't certainly want a driver in a driver's seat to pass out from like heat exhaustion or something like that. So those are measures that we have put into place.
Thank you. Okay, I'm going to go to the next question. This is for Laura and anybody else in the group that would like to answer it. Please repeat the months that you are providing extra pay. Was extra pay provided for all employees or just frontline employees? Has there been any expectation of continuing the extra pay beyond June?
Okay, we wanted to start it sooner, make it retroactive to March. Okay, first, it was only those employees who remained willing and able to work from the onset of the pandemic that were eligible. Say those that started back in June, no, they weren't eligible. So we wanted to do $10, for March, April, May, and June. So since we weren't able to go retroactive, that's why we determined the $20 for each day that they worked during May and June. Does that answer the question?
Yeah, and are you going to continue it past June?
No, I won't say that we won't. Depending on what happens, we may take it back to the board and reevaluate. But as it stands, no. And everyone seemed pleased. I haven't heard any complaints or issues or expectations.
Okay, thank you. Any other panelists that are providing extra pay or bonuses or hazard pay for their employees?
This is Cesar from Community Transit. We provided what we called COVID-19 premium pay. We wanted to avoid the term hazard pay, so we called it COVID-19 premium pay. We made it retroactive to when our governor issued a stay-home directive, and we ended that premium pay when the governor let the proclamation lapse, which was at the end of last month. That was the period that we covered. We had the exit clause was the governor ending the stay-home order. We paid 10% of their salary. What we so that's what we paid, and that's how we ended the premium pay. The union has made a request for us to reconsider and to implement some sort of pay during this period, but we haven't really talked about that seriously. We're scheduled to talk about it relatively soon, but that's where we are at this point.
Thank you. Any other panelists?
Well, and Jacqueline, this is Laura. I might add that part of the reasoning to end in June is we're at the end of our phases, and essentially everything is open in Oklahoma. We're just still practicing social distancing, PPE, etc. But we were kind of aligning it with the reopening. Thank you.
Thank you. Well, along those lines, I have another question for Jamie. Please explain the appreciation bonus. Who got them? How much did they get? On what was it based, and for how long will they be provided?
All right, so the appreciation bonus was determined that we would pay from the middle of March through the end of March, and then for the entire month of April. It was for all employees that worked, and for every hour that they worked, they got $3 an hour for that. So it was done in a bonus format, and it was for part of March and then all of April.
Thank you. This is for the entire panel, and we touched on a little bit. Caesar already talked a little bit that they're not calling it hazard pay, but for those that have not provided hazard pay, did you consider it, and why did you choose not to do it if you didn't?
This is Kelly with Morris Links Transit. We chose not to do it because of the fact that we had so many employees that decided to continue to work. Although we had 24% of our employee base who sheltered in place or had childcare issues, we pretty much had a good bulk of our employees who wanted to stay working. And never did we have any of them ask for hazard pay or a bonus pay or anything like that. And so, you know, I myself and the general manager during one of our daily briefings asked our union president, is that something you want? And he laughed and said, well, of course, but there's no reason for it. And so he said, you've addressed all our safety concerns. We really don't feel like there's a need for that. And so I think that's why we never went there. We've had discussions about maybe some type of bonus at the end of all this, but that's still in discussion, and that needs to be discussed with our board.
This is Jennifer, and we did not implement any sort of bonus or hazard pay at this point in time. We know that we're in this for the long haul in terms of responding to this pandemic. We don't know how long this will continue. And part of our reasoning is also trying to understand the state of Illinois and its financial state. Here in Illinois, the downstate transit agencies rely heavily on reimbursement from the state that's derived from sales tax revenue. So we were trying to be fiscally conservative in terms of deciding whether or not that hazard pay would be worthwhile. And at this point, it's just not something that we are considering.
Okay. Anybody else? Go ahead.
I'll just echo what was already said. This is Lawrence. You know, we're a tourist area. We're heavily dependent on sales tax, and we were working with the union. It wasn't a priority of the union. A lot of drivers have asked about it, but at the end of the day, we have to kind of blend all of the things we've been doing with our financial realities, which is we haven't been collecting fares, and our sales tax is going to be injured by COVID-19 dramatically. So that's where we are.
Okay, kind of a follow-up on premium pay. Was premium pay provided to those employees who worked remotely?
This is Laura. No, we did not provide a temporary increase for those who were working remotely.
This is Cesar from Community Transit. No, the condition was that the employee had to be on base. Yeah, so not for those who were working remotely, but those who did come to base.
Anybody else? Okay, I'm going to go to another question. Several of you are obtaining driver barriers. Do you have smaller vehicles that you are using for transportation, or are you installing driver barriers, and will you still require 6 feet social distancing between driver and rider in the smaller vehicles?
This is Kelly with Martinez Transit. We are installing driver barriers on all of our fixed route buses, as well as our paratransit and our cutaway buses as well. So that will be in place. Our county health officer has, in their order, has listed public transportation, called it out. And so it basically has listed that we, even regardless of the barriers, we need to keep the social distancing as well as the facial coverings. And we even have a capacity limit on our buses. So we're only allowed to hold so many people on some of our, or on our buses, depending on the capacity load for a full bus.
Anybody else want to address that? Okay, well, I'm going to ask another question. There's two about face masks. Is wearing a face mask mandatory or elective? And the other part is, with ADA passengers, did you require face masks be worn when riding the vehicles?
In our rural program, we are requiring the drivers to wear PPE, and we're recommending and handing out generously masks to riders.
Anybody else? Are you requiring riders to have masks?
We are requiring our riders to have masks. Certainly, if anybody does bring up an issue, we handle it through our reasonable modification process, and we do require it for our staff as well.
Okay. Another follow-up along with that, have you had any issues with riders not wanting to wear facial coverings? How are you dealing with them? I would say on fixed route and ADA service.
So this is Jamie again. We have had that issue, and the stance that we kind of took with that is, just to state, well, unfortunately, then the bus cannot move, and we're going to sit here until you put on the mask. And we have found that has actually helped, because you could potentially then have other passengers on the vehicle that might state something. We never want to be, have to call the police or anything out for the matter. We've just been trying to diffuse the situation in the best way that we can.
This is Kelly with MST. I would just add to what Jamie said is that we also put a lot of signage within our buses. There's signage on the outside of our buses, and there's signage regarding facial covering requirements at our transit operation centers. The one thing that's really helping us right now is that this is, again, our county health officer has made this a requirement. So that's something that we can lean on going forward.
Other comments? Another follow-up on the mask then. What, if any, disciplinary actions have been taken if an employee refuses to wear a mask?
This is Laura. If they refuse to wear a mask, they would be sent home.
Yes, this is Lawrence from RAFTA. We did have a driver that refused to wear a mask. We followed up with him, and we got the situation corrected, but he was sent home, and I believe didn't come back for a day. But we looked into it, and he had some issues with breathing, and we were able to accommodate that.
Any other comments? And kind of to follow up with that, there was another one on, and Lawrence alluded to it, has anyone had to make a reasonable accommodation for drivers who are unable to wear a mask? And what did you do in that situation? Lawrence, do you want to take it since you touched on it?
Well, we just worked with the driver to find a mask that was more suitable for him. We are in the process of getting the what we're calling the sneeze guard barriers up. Though I'm not sure if that will alleviate the mask or not. We may still require it. We haven't, to my knowledge, that hasn't really been discussed what happens once those barriers are operational. But I think it was more of a matter of miscommunication and issues with that. So we just kind of took the approach of trying to reconcile the situation, find out what was going on with the driver, and I think maybe he realized the gravity of the situation too, and decided he could in fact wear a mask while driving.
Thank you. Any other panelists experience that?
This is Kelly with MST. We didn't have to do reasonable accommodation, but we did have a couple operators that, for whatever reason, really struggled with the concept of wearing a facial covering. So I had conversations with our AT leadership, and we partnered together, and they had behind the scene moments with those employees to help them understand the brevity of the situation, and then basically gave the okay of on the go forward of disciplinary action. But we've been lucky enough to not have to do that because our leadership has been on board with a majority of the things that we've done at MST.
Thank you. All right, I have another question. We have employees saying it's not fair they have to use their PTO to cover their paycheck when we cannot provide work for them. How do you address this with your employees?
Well, this is Laura, and we covered them. Just if they were idle, just because we didn't have trips, we paid them what they were receiving in January and February. We averaged. If they averaged 60 hours in a pay period, then that's what we would pay him. So we essentially held them harmless. If they were willing and able to work and remained on the schedule, then we paid them, if that makes sense.
Yeah. Anybody that had their staff use PTO or vacation or sick leave while they were out?
This is Kelly with MST. We just had them, we had employees that under the Family First Act that maybe went and were on leave that were only covered at the 2/3 pay. We explained to them that if they wanted to be made whole, they would have to, we would coordinate their benefits similar to state disability or paid family leave in the state of California. And so we didn't really have the issue of that, of them questioning that. We did have some employees who felt like MST should just pay them the leave regardless. And so there was just some educating that needed to happen regarding what the Family First Act required and what that really meant.
Okay. Thank you. Couple of questions about capacity. Lawrence, it's to Lawrence and Kelly. Lawrence, what's the maximum number of passengers you are allowing on a bus? And the other person asked about the capacities on the buses for you, Kelly. So if you guys could both address that, that would be great.
Sure. This is Lawrence. We have it's tight. It's tough. We have on some of our buses, the capacity is only 9 riders, and then on the MCIs, which have been out of service right now because they don't have they only have the front door to load and unload. We're anticipating a capacity of 15 for those buses. So that's why we're working very hard to get those barriers up. But that's our capacity right now.
This is Kelly. With our cutaways and the paratransit vehicles, our rides vehicles, the capacity is about 4 individuals. With our 32 to 35 foot buses, it's about 10, although you can get a couple more depending on family units. And I know that sounds weird, but with social distancing, we don't, if a mom comes with 3 kids, we don't tell the mom, oh, you and 2 of your kids can go because now that's at 10 and the other one has to stay behind. We count them as one unit. And that's the drivers kind of started implementing that on their own, which was, and they told us, and it was like, oh, that makes sense. We didn't even think about that. And MCIs, we are accounting for capacity about 15 to maybe 20. And then we're going to do a campaign of looking at capacity ranges for the buses. So what we're looking at putting out to the public is, if you live together, you can ride together. If you live apart, you stay apart. And so that's our kind of our new campaign about social distancing and capacity rides.
Thank you. I've got 2 more questions and then we're going to close out the webinar. So the next one, has any of the agencies participating in the webinar conducted an analysis of hazards with operators wearing face shields while driving? Has anyone done that?
This is Kelly at MST. We did that early on because we had one of our drivers was using this almost face mask firefighter type of getup for his facial mask, and we had concerns about peripheral vision. We did an eye test with him and he was able to see, and so we decided to do like a case-by-case basis regarding whichever facial covering an employee chose to bring in and use.
Thank you. Anybody else? Anybody else using face shields at all right now?
This is Cesar from Community Transit. We actually have been testing both face shields and other barriers on the coach. We have 3 coaches where there are barriers, and we also provided as a test initially to coach operators on potential hazards with a face shield. Our concern was whether it distorted visibility and created a hazard to the driver. So those are the types of studies that we've done, but that's where we are at this point. And we are going to allow face shields for coach operators.
Thank you. Anybody else want to add to that? Go ahead.
This is Laura. We have the face shields. We don't, they don't have to wear them while they're driving. We highly, strongly recommend they use them when they're securing riders who are in mobility devices. So it's a tool, it's another safety feature for them. The masks are what we definitely require, and we strongly recommend that they use the face shields at least while they're securing mobility devices.
Any other comments? Okay, my last question is it's a big one, very broad. What do you see as HR's position in an organization, i.e. training, communication, policy and procedure creation, job descriptions, new hire, and bringing staff back? Who would like to take a stab at that? I would say all of the above, for sure. I think all of our panelists touched on that, but if anyone wants to say maybe their most important role right now in being in HR during this COVID crisis, maybe we could draw it down to that little piece of it.
This is Cesar from Community Transit. If one thing I would say is to work closely with managers to identify their needs and to better understand the employees who are working remotely. As I made reference in my presentation, there are a lot of opinions or understandings, and there may be a lot of fear. We want to make sure that we address everyone's concerns. So that would be probably the most important thing, is to encourage our managers to be in communication with their employees.
Thank you. Anybody else?
This is Jamie. I would say it is to be human and to really put the human in human resources and to be there for your employees to support them and to know how much they're valued and truly what they bring to the organization.
I like that. Put the human in human resources. I'm going to use that. Anybody else?
This is Kelly.
This is Jennifer.
Go ahead, Jennifer, and then Kelly.
Okay, sure. This is Jennifer. I think one of the strengths that our HR director has had over the past couple months is empathy and flexibility. And she is the one who has really said to us as an executive team, hey, we need to go this direction. We need to put our employees first, and this is how we're going to do it. So I think that it's much appreciative on our end as managers to get that very important feedback from an HR professional.
Thank you, Jennifer. Kelly?
I would say we adopted at MST of looking at ourselves as trying to be role models in a team environment, meaning that if the management was freaking out, the employees take their cue off of that. And they were already very concerned and uncertain because they just didn't know what was going on. And so it was our role to be calming and to be reassuring and to take on, and I don't want to say parental roles, but just being that person to hold their hands during as much as you can with social distancing, but to be there and listen to them and to not overreact and just take each case by case basis and do what was the best for the employee as well as the organization.
Anybody else? Okay, well, I think that was some great advice, and I think we all can, not just HR staff, but be good role models, listen and have empathy and understanding for all of the drivers and the staff that are out there, making sure that there's service provided to riders across the U.S. and providing essential services that are so important right now, especially during this crisis. So again, I want to thank our panel. You guys did a fabulous job and provided us a lot of tools and information. I think that'll help all of the transit agencies that helped. I hope that you all tune in 2 weeks on June 30th for our next webinar, which is on creating a pandemic plan. Registration will be out soon, and as I said earlier, all of the PowerPoints and the recording from this webinar will be on the association website, so you can download it or share it with your colleagues. So again, we appreciate everything that all of you do to keep transit on the road. Keep doing what you're doing and enjoy the rest of your week and stay safe and healthy. And thanks again to our panelists, and we'll talk to you in a couple of weeks. Take care.